part of coming to organization of services in the UK is one of the criteria of being in the ERN is that you will have one healthcare provider, which is an expert center and will be invited to apply to the ERN, but only one in each country. And then this healthcare provider will then engage with other services in the country so that there is dissemination of information as well as collaborative work. So in the UK, we already have some other established centers for vascular EDS. So how we collaborate with them is probably covered in this talk. So I start off with the EDS diagnostic service, where we have colleagues from that service present here today. The National Commissioning Group was established a few years ago, where they decided to commission specifically rare disorders where people with less than 400 were affected. So the national caseload was not considered rare. For example, Marfan syndrome was not in this category because it was not rare enough, they then commissioned the EDS diagnostic service. And I've taken this excerpt from the North London Diagnostic Service, which says that it is specifically established for patients where EDS is suspected, and the rarer types of EDS are suspected. So genetic testing in the UK has changed. When the National Commissioning Group funded diagnostic services, there was one centre which was the Sheffield lab, which actually offered testing for the rarer types of EDSs, and patients that were seen in Sheffield or in the Northwick Park London service had genetic testing undertaken in this lab. But in the last 2 to 3 years, genetic testing has changed in the UK. For us to benefit from genomics, the lab structure has been reconfigured. We now have 7 genomic laboratory hubs. And in these 7 laboratory hubs, 4 of them have been designated for cardiac genetic testing, which includes iotopathies, vascular EDSs, connective tissue disorders, as well as cardiomyopathies and ARVC as well. So Guy's and St. Thomas's actually fall under this category, London South GLH, and they work in collaboration with both the St. George's and the Brompton lab as well. How this will change the national commissioning services that are already established for diagnostic testing is still unknown. So in London, I'm focusing on the 2 services. In GSTT, we didn't start off as a diagnostic service. We started off as a diagnostic and management service for patients specifically with iotopathies and vascular EDS. And in our center, we have the ability to provide both adult and pediatric expertise in specialist MDT clinics. So we have a weekly MDT clinic where both pediatric and adult cardiologists are present for diagnosis and management of patients. Specialist aortic and vascular surgical teams are also integrated in our pathway. We have a weekly MDT with our vascular and aortic surgeons. In addition, pre-pregnancy counseling and management is also well established. And as I said, we went on for the application as a diagnostic and management center for iotopathies and vascular EDS when the ERN application came forward, and we have been approved as a HCP for HDAD and MSA. Northwick Park in London, initially, although they established as a diagnostic service for vascular EDS and other rare syndromes, now have also involved management of these patients. And I know they work in collaboration with Great Ormond Street and Barts Hospital and with some specialist MDT clinics. And Barts is another North London hospital with large cardiothoracic service and has the ability to provide both adult and pediatric services, including surgical and obstetric care. So in summary, that is a service in London, and I'm hoping that we have started collaborative work in a lot of areas anyway via some regular meetings that we have, specifically the Pan-London Iotopathy meetings. The centers involved I've outlined there. Hopefully we are sharing expertise in these meetings, as well as considering more collaborative work as well. So VASCERN initiative specifically, we are hoping that we will be able to disseminate that to other centers through these meetings and grow in our collaborative initiatives. So that's me. Thank you for listening.